Habari yako.
Mzuri.
And what is your name?
John Mwaniki.
And where do you live and where is your practice?
I practice here in Nakuru town.
And what type of services do you provide?
I give reproductive health care and also curative care. Minor surgeries is also something that I also do.
So like minor stitching?
Stitching, circumcision, yeah, those kinds of things. Maybe incision and drainage.
Of course,
Yeah,
okay.
those kinds of things, yeah.
And on average, how many clients do you see a month?
I would say roughly 140, 150 there.
Yeah. And can you tell me a little bit about your clients, where they come from and their income levels?
I would say most of the clients I get come from different economies. I would say we have some people who normally live in slums, in the same vicinity there. I'd also say there's a bit of catchment on middle income fellas. Yeah.
Okay. And how much do you charge for services?
Okay, this one's valley. Depends on the cost of the drugs that somebody's taking. But on average, I would say we charge about 300, 250 to about 500.
Okay.
Yeah.
And can you tell me how much you're asking for and what you will use the loan for?
Well, I would have wanted 130,000. One, I have a car. I normally use a lot to cater for the welfare of the patients, one or the other, because sometimes you can get an emergency case and you go to refer. Most of them are needy. They are not able to even meet the cost of hiring transport. I use that car. Sometimes I'm even called during the night to go attend to them to the clinic, and you cannot be able to access the clinic, especially when you're not using a car. And it's a lot of vagary in the vicinity where I stay in, so it helps me a lot, a great deal. Yeah, and the other amount I would want to use on improving my clinic, say for example now, the floor is kind of dilapidated. I would want to make sure that the floor is repaired somehow, and buy trucks. That's the most important thing I would say.
Okay.
Yeah, even if I fail to possibly get the money for repayment of that amount of remaining to clear the price of my car, drugs are the most important thing.
And the last question is, what do you like about your work and why do you do it?
I like it, and this one is something that I've liked from the word go, should I say, since I came to know myself, because I was brought up in an area where people had dire need for medical assistance, and it was not readily available. So I started developing the interest from the place where I was brought up.
Okay, asante sana.
Asante sana.